what can guys be doing now to improve their sexual health during these trying and kind of wacky times? Any advice for hooking up during COVID times?
Well, I think it's very important to, keep following the COVID-19 guidelines. BC CDC has put some out, and, on social media, we're maybe all like seeing glory holes trending, and some people might think that it's a joke, or that, it's like not real, but actually that is one way to prevent, transmission of fluids. A wall in front of your face, prevents kissing. And so I think it's very important to, keep that in the forefront of your mind, all of the steps that you can take to have safer sex in this time. But also I want to add that, like with all of the guidelines and restrictions that, we're all reading about, it's very important also to consider the type of messaging we're giving to guys who are having casual sex at this time, and to remember that, we always should be in the realm of sex positivity, and stigma is one of the biggest barriers that people face when accessing sexual health care. And so if we can eliminate stigmatizing language or shaming language when we, give advice to our friends and family around sex, that will actually add a lot to the safe ways that we're having sex also.
Totally. Be proud of your glory hole usage.
I just want to add one other message I think that's very important is we definitely have had a lot of people stop their PrEP because they've said, oh, I'm not going to have sex, I'm going to be at home, I'm avoiding COVID. But let's be honest, like sex happens and sometimes you don't really plan it. And I think there are two important things I would like to say. One, the clinics like him are still operating. If you get symptoms of something, come in, we need to treat you. But more importantly, our NPEP program still continues to offer PEP. So if you had an exposure where you weren't on PrEP, don't feel shy. You need to come in and get NPEP. We don't want people to forget about post-exposure prophylaxis because it's a backup option if you had sex and you weren't using condoms and you weren't on PrEP. So we'll make sure people think about NPEP.
Yeah, I think just basically just to communicate your comfort levels, I think is always like I said before about basically just communicating if there was any symptoms that were coming up that you were experiencing as well on the other side of that, of just making sure that you're just being as communicative as possible. I think that's just the biggest thing to do. And basically just do it with respect, and like Darren was saying, try not to do the full shaming thing if your friends do come to you with advice, and just make space just to hear them, and just always just like follow what Dr. Bonnie Henry is saying basically. Thank you.
Alrighty, guys. Thank you all so much for all of your answers. I'm feeling full of knowledge. That is all the time that we have for now. Once again, I would like to thank the three sexpert panelists, Darren Ho, Dr. Mark Hull, and Adrian Bustamante, for sharing their insights with us today. These folks all live and work in our community, and their organizations are working to improve the health of queer and trans British Columbians. We can never have enough discussions about our community's health, especially during Pride season. Huge shout out to ViiV Healthcare for sponsoring this event. If you like this presentation, make sure to follow Community-Based Research Center at BC GbMSM and YouthCO at YouthCO for more content. And if you liked me, you can follow me at Kendall Gender on every social media platform that your little heart can imagine. To leave you with this amazing, amazing words from the fierce Dr. Bonnie Henry, be kind, be calm, and be safe. Happy Pride, everyone.